Good morning. This is Rich Bendis, and we're starting our second day of our 7th annual BioHealth Capital Region Forum. And we're excited to have our opening speaker today, and we're going to do a fireside chat with Dr. Anthony Fauci, who is the director of the National Institute of Allergy and Infectious Diseases, known as NIAID. And we know that he's got a very busy schedule, so we're very pleased that he took the time to address our audience of global attendees of over 1,000 people attending our BioHealth Capital Region Forum. So, Dr. Fauci, welcome to the forum.
Thank you. Good to be with you.
Yeah, thank you. And, you know, a lot of people see you all the time on TV, but probably don't know a lot about your personal background. So I'd like to have you give the opportunity to talk a little bit about how you got to where you are today, a little family history, education, your medical career, and then why public service with the NIH?
Well, I'm a physician primarily. I was educated mostly in my pre-medical training in the classics, actually, which is unusual. Classics and philosophy, you know, Greek, Latin, Romance language, philosophy, fundamentally Jesuit-based training in both high school and in college. I decided I want to become a physician somewhere halfway through high school because I felt I wanted to do something related to people because of my humanism training that I had with the classics and philosophy, combining that with my affinity for and liking of science, which I was always had a strong affinity for, that I thought the best way to combine that would be to go into medicine, where you can be involved with real people, but you do it in a way that is based in science. I went to medical school, did the standard training of multiple years of residency in internal medicine. And I believe the thing that really formed the basis of where I am right now was a 3-year fellowship I took at the National Institutes of Health in a combination fellowship of infectious diseases and immunology. I did that for 3 years. Then I came back to New York City, where I originally trained for a chief residency in medicine at the New York Hospital to finish off my clinical training. And then I made a decision I would come back to the NIH to start a career as a senior person in clinical and basic research in internal medicine, infectious diseases, and immunology. And I've actually been doing that ever since. And that's been now more than 40 years. In 1984, a career change when I accepted the position of the director of the Institute, the National Institute of Allergy and Infectious Diseases, where I was originally trained as a fellow. I've been in that position now for 37 years, and I'm still in that position right now. That position has put me in a position to be involved very directly and intimately in essentially all the major infectious diseases outbreaks that have occurred since then, including HIV, Ebola, Zika, chikungunya, pandemic flu, and most recently, what we're knee-deep in right now is COVID-19. So that really is the thing that led to my role as a public servant in the arena of global health. So even though my identity is still that of a physician and a scientist who still does research, I'm known much, much more widely for my role as a public health official leading the charge against outbreaks, and in this particular case, the outbreak of COVID-19.
Right. Well, thank you for your service. I think the world thanks you for everything you've been doing over the last 36 years, and especially the last 2 years. You know, a lot of people don't understand a lot about NIH's makeup and all of the different institutes involved. But I think we could do a little deeper dive on NIAID, your institute, talk about its mission primarily, and how it's grown to be over a $6 billion institute within NIH, which is very significant and very important to the overall health of our country.
Well, there are 27 institutes and centers at the NIH. When I became director in 1984, the National Institute of Allergy and Infectious Diseases was like the 6th or 7th largest institute. It was a rather quiet institute that really was not on the forefront of many things, because at the time it was felt incorrectly that most infections were under control with the vaccines against polio and smallpox and measles, mumps, rubella, et cetera, et cetera. But when I became the director, a new era of infectious diseases was opened with the pandemic of HIV/AIDS, which began in the very early 80s at the time when I became director of the Institute. And since that time, the Institute has grown exponentially from the 6th or 7th largest institute to now the 2nd largest, closing in on the 1st largest. So as you mentioned, it's over $6 billion, second only to the Cancer Institute and considerably larger than the National Heart, Lung, and Blood Institute. And that really is reflective of the amount of emphasis that was put on our response to emerging infections, and the ones that I mentioned that at least have been prominent during my tenure as the director. You know, HIV/AIDS involving 77 million people, 36 million deaths in this country, close to 750,000 deaths. We now have 38,000 infections a year, as well as a variety of other infections. And right now, COVID-19, the impact that that's had on society, not only in the United States, but in the world, is profound. I mean, we now have 650,000 Americans have died of COVID-19. Worldwide, over 4.5 million people have died from COVID-19. So the magnitude of the problem in domestic and global infectious disease is the reason why my institute has risen to the prominence that it has right now.
And the other thing, with 37 years at one institute, that's not normal. Nor you normally have a lot more transition within institutes, but you've also worked for 7 presidents, both
Yes.
Republicans and Democrats. And I guess, is there a challenge in trying to stay true to the NIH and the NIAID mission when you have the different personalities and administrations do you have to work with?
Well, you know, it could be a challenge, but it really isn't that difficult, because if you just stick with the science, the evidence, and the data and the truth, then you're okay. But if you start getting involved in political issues, then you have a problem. So I've steadfastly tried and succeeded in staying out of the pure political issues and sticking purely with the scientific. So when you're dealing with 7 presidents, I learned a lesson early on: always stick with the science and never be afraid to tell a president something that he may not, or she, we haven't had a she yet, but
Yeah, right.
that he may not like to hear, because you sometimes have to tell someone an inconvenient truth. And I found that when you do that, rather than having presidents get upset with you, they respect you more for telling them the truth about things. A recent exception to that is noteworthy, but we won't go into that.
We're not going to get into politics today. Right. Yeah. So, you know, we appreciate, and I think our audience, since we have a highly scientific audience, appreciates your sticking with the science. And when we talk about, you mentioned a number of the other pandemics that have occurred during your tenure, as well as prior to your tenure, that have impacted people globally. How do you compare COVID-19 to some of the other pandemics that you've had to address during your career, or what other people have had to address prior to your taking over NIAID?
Well, it is historic in its impact. There's no doubt about that. This is the worst outbreak of a respiratory-borne disease that we've had in well over 100 years. That's for sure. HIV in magnitude is comparable, if not more, but it took place over 40 years. So HIV was insidious in its onset early on, not fully realizing what the total scope and potential of it was back in 1981 when the first cases were noted. But if you look at the impact over 40 years, it's been profound. That's pretty different than COVID-19, which was explosive in its nature. And in less than 2 years now, has already killed, like I said, 650,000 Americans. So there's nothing like it that we've ever seen before. The other thing that's distinctly different with COVID-19 from any other outbreak is the extraordinary political divisiveness that has permeated everything we've done. We've been through crises that are public health challenges. There have been some political differences that really weren't as sharp and deep and pervasive as the political differences and the politicization of the response to COVID-19 that we've never seen with any other outbreak. And that's really unfortunate because we forget that the common enemy is the virus, not each other. And yet, if you look at what's going on in the country, it looks like we're fighting with each other instead of fighting against the virus.
And I just read an article yesterday. It says that we really have a regional pandemic now, a lot of that based on some of the beliefs you're talking about, whereas we have control in some regions and other regions are really out of control.
That is true. I mean, it's striking that if you look at the map of the country, the under-vaccinated areas are almost exclusively the red states, and the vaccinated areas where there's lower level of infection is mostly blue states.
Right.
I mean, that's extraordinary and ridiculous that you have a political division of how you respond to an outbreak. That just doesn't make any sense at all.
Yeah, so I agree with you. Just believe in the science. So, based on everything and where we've come from to where we are today, where do you think we are in controlling COVID-19, and what has to be done by everyone to really address this dreaded disease that we have today?
Well, the answer to it all is vaccination. I mean, those areas that are vaccinated to a high degree are doing very well. The only trouble is what you do impacts what others do. So you can't live in a vacuum and not care if you get infected and not care if you spread the infection, because you will negatively impact the whole country. The solution to the problem is to get the overwhelming majority of the population vaccinated. And if we do that, we will, I believe, easily able to suppress this virus to a level so low that it's no longer a public health issue and is no longer a public health crisis. Whereas if we continue to have the 75 million people who are eligible to be vaccinated who did not get vaccinated, then we're going to have a chronic smoldering problem. And that's really unfortunate because we have the wherewithal and the power within our grasp right now to convert it from a smoldering problem to a non-existent problem. But we apparently are not doing that very well because we still have so many people who don't want to get vaccinated.
And I think one of the other challenges is, and with your 37 history, this, is that this will not be the last pandemic we have. There will be other pandemics that are going to emerge in the future. And while you're trying to fight this pandemic, what do we do to be better prepared for other pandemics that may arise in the future?
Well, we do what's called lessons learned. We looked at what happened with this pandemic, what went right, what went wrong. One of the overriding successes in the response to this pandemic has been the science, the development of vaccines in absolutely record time. No one would have imagined in their wildest dreams that you have a virus that's first recognized in January of 2020. And before you get to the end of the year in December of 2020, you have more than one vaccine that has been proven to be highly efficacious and safe And now that we're yet again another year into the outbreak, the real world effectiveness of the vaccine has been proven time and again. It's still a highly effective vaccine. We have a challenge of having to deal with variants which result from mutational changes in the virus that lead to a variant that might diminish the effectiveness of antibodies, either monoclonal antibodies or convalescent plasma antibodies or antibodies induced by the vaccine. That's why we need to continue to see how we can address this, and providing boosters is one of the most effective ways to do that. And that's why you'll be hearing about the rolling out of a booster program reasonably soon.
And then basically, how do you balance the research with your, hundreds or thousands of researchers you have at NIAID right now with all of the other areas that are an important focus for the Institute as well as us as citizens of the United States on potential other diseases or existing diseases that we have to fight?
Well, you have to provide a balance. You can't be disproportionate where you focus almost all of your resources in one area. And we do. I mean, we have very important diseases that we can simultaneously address. HIV being one of them, COVID-19 being another, internationally malaria and tuberculosis. Those are important. The possibility of a pandemic influenza, as well as a variety of other diseases. So we've done that for quite a long time now, and we do have the capability of simultaneously addressing more than one serious problem, which is what we are doing, actually.
It's probably that Jesuit background that enables you to have the balance in your life. I had the Christian Brother background, so I understand how discipline is extremely important. And one of the things about that discipline is I know that your schedule starts early in the morning, goes till late at night. And how do you balance the work life, and plan that you need to have for yourself and your family? How do you basically devote time to other things other than this critical pandemic that you're fighting every day?
Well, unfortunately, the reality is that there is not a lot of work-life balance, and it's really been work. It's just, necessitated by the extraordinary challenge that we're facing. I would love to be able to take time off, but I just can't. I actually haven't had a day off in 20 months, which is crazy. I mean, I know that doesn't make any sense, but really every time you're even thinking about taking a little time off, something else goes on that requires your attention. So we're going to get through this. And when we do, then I'll worry about taking a day off. But right now, that doesn't seem to be fitting into the agenda.
Well, I guess you can't even sneak away for a Washington Nationals game right now. But, when they're 15 games behind, maybe there's not as much motivation to go see them, right?
Well, they got rid of all of my favorite players. I mean, getting rid of Anthony Rendon was really bad. Getting rid of Max Scherzer is really bad. Getting rid of Trey Turner was the icing on the cake. I mean, I can't understand how that happened. So, but
well, it's all about the money, basically. Yeah. We all know how that works, right? Yep. But hopefully next year. Another thing that we have in our audience is we have a lot of STEM students and postdocs, and we get exposed to them every day with the kind of work that we do. And, you have there's thousands of postdocs within NIH. And so what advice do you have for them in selecting this health related public service career where they will have many opportunities? They could go into industry, they could stay with government, they could do many different things. So what kind of advice do you share to those out there that would like to potentially follow your path, or what other advice would you have for them?
Well, my advice is always really rather a common denominator, is figure out what really turns you on, what your passion is, and realize that when you go into a field like our field, that one of the beauties of it is that it is really, as you mentioned correctly, it's total potential. I mean, you can go into the field of science and public health and do any of the things you just mentioned. That's one of the really exciting and attractive aspects of this type of a professional career pursuit is that you have the opportunity of going in so many directions and even changing directions. You know, you asked me about my own history, and that's, I think, a perfect example of evolving in your direction. My first goal was to be a practicing physician. I wanted to go to medical school, get my residency training, get a specialty training, and practice medicine. Then I got interested in science. My interest in science got me interested in certain diseases which were public health related. Then when I became director of the Institute, I became very involved in public health issues, which got involved in policy issues, which just evolved and evolved. So it was never anything static about my career. It's always evolving. And that's what I think my advice to younger people would be, is that it can be really an exciting journey if you follow your passion and you follow what it is that you'd like.
And, you know, we're very fortunate having in this region, we call it the BioHealth Capital Region, which is Maryland, DC, and Virginia, because we never had a brand before. And we always had to compete against Silicon Valley or Route 128 or Research Triangle. But we have unique assets in this region that no other place in the world has. When you have NIH and the FDA, and we have CMS, HHS, we have the largest research university in the world with Johns Hopkins in our backyard, and we have some major industry players. So is there a benefit for you and the work you do and NIH being located in this region and having access to all of those assets that help you achieve your mission?
Oh, absolutely. I mean, no doubt about it. And you left out Walter Reed, which is
Walter
really
Reed,
cool.
sure. Yeah. So
no, actually it is. It's really a hub of medicine, biomedical research, and public health. You're absolutely right. I mean, to have within literally a 5-minute drive around here at DC, you have all the Georgetown, Washington Hospital Center, GW, you mentioned Hopkins, Walter Reed, FDA, NIH. It's really an extraordinary concentration here within very, very easily accessible.
And one of the exciting things, you mentioned Walter Reed, the old Walter Reed campus is being converted into an innovation campus with Children's National Hospital, right. Virginia Tech, J Labs with J&J, and BARDA all in one location there. So that's just going to be another little cluster that's going to only enhance our region, I believe.
Right. And now you just mentioned now, and I forgot to mention, you're right. We have a lot of collaborations with Children's Hospital. So to have one of the most important pediatric hospitals in the country, if not the world, literally in your backyard, just enhances the capability of what you can do.
And having another physician like Dr. Newman, who shares your passion, is nice to have him as a partner to work with, I'm sure.
Yeah, absolutely.
Yeah. So are there things that we haven't discussed that you think our audience would like to hear from you, Dr. Fauci, if I give you an open mic so that you can basically discuss anything you'd like?
Well, I think we hit upon it sort of indirectly, is when we're talking to young people who are interested in going into this field, how exciting it could be, how totally potential it is. And I encourage younger individuals, if you have any inclination at all of wanting to pursue a career path such as we've been discussing, now I encourage you to give it some serious thought, because it really could turn out to be very exciting.
And then you can look at what can happen with your career. You could end up being 37 years as the director of one of the major institutes in the world.
Right.
So I want to thank you very much for taking time out of your busy schedule to appear before our 7th annual BioHealth Capital Region Forum audience today. I think you've shed some light on some topics that they may not have heard, and they learned a little bit more about Dr. Fauci. So thank you very much for appearing with us.
My pleasure. Thank you for having me. Good to be with you.
You're welcome.